This conference will now be recorded.
Good morning, students. I hope the slide is clear. I'm audible. Manoj.
Yes, sir.
Okay. So we tried understanding the policy issues that were surrounding the vaccine safety yesterday. Today we are going to understand about the clinical issues surrounding the vaccine safety. If you see the vaccine trials, vaccine clinical trials, most of the vaccine clinical trials focus on their efficacy. What is the difference between efficacy and effect? Let us understand. This is very important. Navindran, what is the difference between effect and efficacy? Navindran is there. Amal, Jishnu, Anne Maria.
Yes, sir.
What is the difference?
Efficacy means when we check in trials like in intervention or performance, we have to get a proper effect. But in effect, the other effect means we have to get the intended effect in the real world. I don't know it's correct or not, sir.
Aparna?
So efficacy means to produce a result.
Can you be louder, please?
So efficacy means to produce an effect,
Effect means?
a result.
Okay. Aquina?
Sir, efficacy means the ability to produce a desired or intended action or result.
Effect means?
Effect means impression that produced.
Benjir Akhtar?
Sir, efficacy means that result, like it produces effective result or not, and that effect is like it measures. I don't know, sir, exactly.
Giarli?
I don't know.
Irene Sarah?
Sir, efficacy means, sir, it's the ability to produce any result, like desired result.
Effect means?
Sir, effect means something, a change which is a result of any action.
Kamal?
A change that happens.
Okay, okay. Kamal? Cassia Korean?
Sir, efficacy, any desired outcome we intended to happen and affect any change.
Cassia Rachel?
Yes, sir. Efficacy means the action produce a clinically measurable effect under ideal conditions.
Effect means?
Effect means action achieves the the intended health result under normal circumstances.
Lakshmi,
Efficacy means ability to gain an effect. It's effect of treatment.
effect means
Effect means measure the beneficial effect of a drug.
Manoj, Manoj,
Efficacy in terms of like under controlled circumstances.
effect means
Effect means in the performance in the real world, like how is it working in the real world?
Megha,
Sir, efficacy means the intended performance needed to be produced, whereas effect means how much of this efficacy is produced in a patient.
Marlin,
Sir, efficacy is how effective the drug is to produce an desired outcome, and effective, I think, just the action of the drug.
Nikita, Vikraman, Ria Pillai,
Sir, efficacy is something desired effect that is produced, and effect is degree to which something is successful.
degree to which something is
Successful.
Okay. Ria Sara,
So efficacy is the therapeutic outcome that that's produced after a vaccine is being vaccine is being administered, and effect is the action that's shown in the patient.
okay. More or less, you people are near, but totally got confused between both of them. Okay. Effect is the result of drug action, which we are very clear from our pharmacology background, correct? When you give the drug, it acts on the body and produces the result known as effect. So all drugs will produce the effect. For example, if you take a simple example, antihypertensive drugs. We have many antihypertensive drugs, correct? All will produce what type of effect? Anybody can tell me? All drugs produces what type of effect? Anybody can tell me? All antihypertensive drugs produces what type of effect? No answer. Not even 1%. All antihypertensive drugs produce what effect?
Decreases the BP.
Correct.
Blood pressure.
Why? Yeah. Why are you confused? Why you people are confused? Very simple one. All antihypertensive produces the effect. Whether we use all the drugs for treating the patients, whether we use all the drugs for treating the patient, yes or no?
No, sir.
No. So which are the drugs that are preferred for treating hypertensive patients commonly? Sorry,
diuretics, calcium channel blockers.
diuretics and
Calcium channel blockers. Beta blockers.
AC inhibitors. Please mute. Somebody's audio is on. Please mute. So commonly we use AC inhibitors, angiotensin enzyme. I mean angiotensin beta antagonist, the angiotensin antagonist, receptor antagonist, as well as beta blockers, and finally calcium channel blockers, as well as diuretics. Diuretics we use mainly when we have edema, correct? So why do we use only beta blockers or AC inhibitors or angiotensin receptor blockers? Is there any reason for them, for it? Can anybody tell? Is there any reason?
Sir, those drugs are more efficacious than the other drugs.
How did you say that now they are more efficacious? On what basis?
Sorry, sir.
On what basis you said that they are efficacious?
Sir, the rate of showing the effect.
Rate of showing the effect. That means they can produce more decrease in BP with respect to safety.
Yeah.
What is their effect, safety wise? They're more safe or less safe?
More safe, sir.
More safe. See, now we have understood. Did you understand now? Effect means it is the result of drug action which every drug will produce, which comes into the class. Whereas efficacy means what is the extent of the effect that is produced by each drug. That is called as efficacy. As somebody told, they could not able to put it properly, but their answer was correct. Degree of the effect. Degree of the effect is called as efficacy actually. Degree or the level of the effect is known as efficacy. That was the right answer actually, but it was confused, that's all. So all vaccine trials focus on the vaccine, which vaccine is good, whether it is going to protect the health of many patients. That is how they look at it. Okay, but these studies rarely focus on the, or less focus on the, have less focus on the safety profile during the clinical trials. So what is the issue is that they focus is the issue here. They focus on the efficacy of the vaccine rather than the safety part of it, because they think that the adverse effects are not frequently produced. So that is the issue actually. So one has to look at both efficacy as well as safety part. Are you clear? Can we move on to the next one? The next issue is that it is difficult to observe rare adverse events in vaccine trials when compared to common adverse reaction. See, we know that every drug produces at least 5 to 6 common adverse effects, but vaccines do not produce common adverse effects in all the patients. They produce rare adverse events, and one in large population, or one in very large number of patients. So that is why it is very difficult to observe such kind of adverse event. So it is very important to observe the adverse effect when vaccine is given for the large population of the patients. Okay, that is the second issue. Next issue is that the assessment methodology varies for documenting ADR, and culture and health system also influences such documentation problem. See, we are very clear about the drug. If you administer 50 mg of the drug, adverse drug effect number 1 is produced. If you administer 500 mg of the drug, adverse drug reaction from number 2 to number 10 is produced. And also there is a proportionate link where causality can be assessed, because the drugs are given and they are likely to produce the effect, and the effect ranges from say 12 hours to 24 hours, sometimes 46 hours. So you can exactly say that yes, this adverse drug reaction is produced because of this drug only, because we know the bioavailability of the drug. And the extent of action. But vaccines are not like that. Vaccines are given at the lowest amount which is safe for the body, and once they are injected in 0.1 ml to 0.5 ml only. They are not injected in 1 ml, 2 ml like that. Very rarely they do that for some vaccine mixtures, but otherwise it is usually from 0.1 to at least maximum 1 ml, not more than that. And once they have administered, that's it. You cannot say that when the action of these vaccines are going to be end up, because we know that vaccines contains the inactive form of the microorganisms. So the inactive microorganisms will become active and start stimulating the body to produce antibodies. Those antibodies start affecting the organism which invade the body. So it takes its own time, but they say that the vaccines are usually have the efficacy at the the extent to protect the human body for about 6 months, 3 months to 6 months time. So during this particular time, because of the one dose of vaccine, you do not know whether the adverse reaction that was reported by the patient, is it because of the vaccine, or is it because of the food effect, or is it because of the disease effect? It is very difficult to what you say, identify. So the methodology is extremely difficult in order to assess the ADR that is associated with the vaccine. Now, on top of it, our culture, not only our culture, any culture in a country also will influence such a reporting system. The moment some family members start saying that no, I have this problem, is that somebody in the family, they're not aware, they say that, oh, that is because of this reason, that reason. They give a different their own reasons and prevent the person from reporting the problem. So that way culture also will have a problem. Say for example, in our country itself, there are many cultures and many religions. We all have a set of our own belief, and they are strong also. They will not allow us to disclose what is the actual problem to the medical fraternity. Even if it is told to medical fraternity also, the health system in our country, for example, is not so much developed or sensitive enough to grab it. They'll also say that, okay, this is because of that and this reason, and that is how the problem usually comes. So that is why the documentation of the ADR data that is associated with the vaccine is very poor, not only in our country, in majority of the countries, including developed countries. So that is a problem. So assessment strategy should be different. So that is where this pharmacoepidemiology helps to apply a different strategy with respect to methodology to document ADM. So this is the another clinical issue which we come across. Now, some vaccines caused death in developing countries, and the reason for that, they say that the vaccine sequence or vaccine non-specific action are the reason for the effect. Therefore, long-term studies are required to follow adverse event following immunization. Adverse event following immunization. I have told you in the beginning only, pharmacoepidemiology, when we are trying to understand how pharmacoepidemiology is related to the assessment of safety following the vaccination. At that time, we have used this abbreviation. Anyway, now some vaccines cause the death in patients in some developing countries. Now nobody knows why that was produced, but it is proposed, strongly recommended that, or proposed that, the change in the vaccine sequence, because we know that the vaccines contain attenuated form of microorganisms. So what happens is that over a period of time, gene structure in the microorganism do change, because they are only inactivated form So there is always a chance that the attenuated microorganism may change its gene structure and produces the chemical that may change the vaccine sequence altogether, and that may be responsible for the death of the patient. And sometimes vaccines becomes completely inactive. Sometimes it produces the action which is extremely different from the one which is expected. So therefore, what they say that not only after vaccination you're going to follow for 24 hours or maybe one week, but it is important to follow for long term, say for example, 6 months, 2 years, 5 years, like that, to follow what happens following the vaccination. That way, you will get the data which may takes place over a period of time because of gene changes or because of any structural changes. Because we all know that gene effects is not seen to be instant or within 24 hours, but they take their own time to express in the body. So this is another clinical problem where a vaccine changes its sequence or produces the action which is totally opposite or not specific actions, and that may result in the safety issues. So long-term study is a dearth or the deficiency which needs to be followed up. Now, whenever we introduce new vaccination, so especially for malaria, TB, rotavirus, whatever it is, the safety needs to be taken into the prime importance, especially during the pre and post licensure period, before giving the license or after giving the license, especially in those countries where resources are limited. In measuring the adverse consequences. This is very important. If a country do not have a health system that can assess the safety of the vaccine, especially if it is a new vaccine, so in those settings, in those countries, before giving the vaccine or after giving the vaccine, it is very, very important to wait and watch for the safety. Okay, otherwise it is going to cause the death in many patients, which is seen in most of the countries as on today. The next one is that the pharmacogenomics and biobanking studies helps us to study high response or poor response of patients to vaccine. What is pharmacogenomics? Any idea? Now, Amal Jishnu, what is pharmacogenomics? Anjuvarki?
Sir, study of role of genome in drug response.
Genomic drug response. Can you make it more specific?
No, sir, that much I know.
No, your answer is correct. They put it in a simplest manner. You said genomic drug response, correct? You put it in a simplest manner. What do you mean by the genomic drug response?
It's combination of pharmacology and genomics.
Okay. Anne Maria?
The study of drug response with respect to the genes present in the body of individual person.
Study of the response of the body with respect to
Response of drug in the body.
okay. You want to study the response of the body to drug based on the
Drug to the depending upon the gene change in the body, respective of the genes
correct.
present in the body of the individual.
Yes, correct. So Anjuvarki definition is very clearly modified by Anne. Good. Now, That is what the pharmacogenomics. The drug effect, changes in the body based on our gene structure or gene presence. Correct? This is known as pharmacogenomics. Now, it is very, very important for us to know the effect of gene on the drug response. Based on the gene present in our body, we respond to a different extent to drug. Some of us are highly responsive to drug. Some of us are less responsive. Some of us are moderately responsive. The response of our body to a drug depends on the gene structure. So it is very, very important to identify the patients who are hyper responsive or hyporesponsive for the vaccine. Then you can take the measure. Those who are hyporesponsive or poor responsive, you can give more dose or more booster doses. If the patient is hyper-responsive, lowest dose can result in the what do you say, a severe effect in a patient. So identifying the pharmacogenomics of the patient is also very important in order to understand the response of the body to administered vaccine. Correct? Next one is biobanking. What is this biobanking? Any idea, Aparna?
So, some collection of biological samples,
Such as?
um, tissue samples, for example.
Yes, tissue samples are the genes actually.
Yeah.
So the collection of tissue samples are the body components for the use or for the assessment of the response of the drug over a period of time is known as biobanking. So biobanking studies also help. So what happens in that biobanking studies is that they collect the gene which is present in the, say, WBC cells. Okay, they collect from the WBC cells and then they store it, and in the cold freeze temperatures of 130 to 150 degree Celsius minus Celsius, and they store it for, say, 1 year, 2 years, or maybe 10 years, how much ever they want it. But it also depends on the degradability. You cannot store for many years. They have a lifetime of 1 year or maybe 2 years. I think maximum is 5 years, not more than that. So within this period, they conduct the research studies using that samples. So especially collection of the genes or any body component or the fluids which can show the response to the vaccine becomes very important during the vaccine study. Next one is the resource limitation. The resource limitation. Suppose if the facilities are not good, as we have already understood, facilities is not good in a hospital or in a country or in a health system, where it can cause the problem to limit the collection of the data regarding rare adverse drug events or rare adverse events. So at that time, you may have to continue the study for a long period of time in order to get complete data, So these are the issues from the clinical side that are associated with the vaccine safety, where pharmacoepidemiological concepts are needed, right? So are you all clear with the clinical issues? Can we move on to the next one? If you have anything, please clarify, because pharmacoepidemiology concepts are going to be used from that direction. So understanding of earlier issues is very important. Anybody has any clarification? Can we move on to the next section?
Yes, sir.
Yeah. The next section is that how pharmacoepidemiology research is going to be used in the study of vaccine safety. Earlier, we have understood that there are methodological problems in order to assess the safety of the vaccine. Now, in this section, we are going to study how pharmacoepidemiology helps, or research helps, in order to study such kind of vaccine safety. The first concept or the first approach, pharmacoepidemiological approach, is signal detection. Signal detection. Let us see what it is. What is a signal detection? See, whenever the drug is given to the patient, we come across what type of adverse effects, which are classified. Can somebody classify the adverse effects produced by the drug? How the adverse effects are classified generally?
The mild, moderate, and severe.
That is the clinical aspect. Otherwise, basically, pharmacologically, how they're classified.
Very common
And
very common, rare,
oh, that is
very
also
rare.
pharmacoepidemiology. Don't tell me pharmacoepidemiological definitions. Tell me the pharmacological one.
The chronic and dose related,
No,
non-dose
that is
related.
also pharmacoepidemiology. Pharmacology classification I need. You know that, very simple it is. When a drug produces adverse consequences, it can be of two types. Which are those?
They're exposed and not exposed.
What is this? Okay. Aquina, let us go.
Sir,
Yes, Aquina.
sir, common,
Common and
common
And uncommon.
common and uncommon. Okay, this is the layman term. Put it scientifically or professionally. The same words.
Sir, I don't know.
Okay. Benjit,
Don't know, sir.
forgot pharmacology, yeah? Jerly, Irene Sarah,
Sir, I don't know, sir. I don't remember.
Kamal, Kessia Kurian,
Don't know, sir.
Kezia Rachel,
Sir, predictable and non-predictable.
yes, got it. Very precise answer. Predictable and non-predictable, unpredictable. It's not non-predictable, it is unpredictable. So I will ask you one more question to you. Predictable one can be expected.
Yes, sir.
Unpredictable one,
Unexpected.
unexpected. Whether you know them, unpredictable one.
Um, I don't know. Side effects.
Now, unpredictable one, do you know that this is going to produce? Unpredictable one. Predictable one, you know that is going to be produced.
No.
That confused, huh? Okay. Actually, when you administer the drug, as per the pharmacology, there are two types of adverse consequences which you can expect. One is a predictable one, other one is unpredictable one. Predictable adverse consequences are always can be predicted based on the pharmacological actions, whereas unpredictable one is not related to pharmacological actions and they are unknown. They are unknown. So they are called as unpredictable one. Okay. So similarly here also, what happens is that the same concept we are going to use it as a signal. Whenever you want to study, you're going to identify the signal or the indication. The signal, adverse event signal, will be known and it will be unknown. Known and unknown. Exactly. Predictable one, unpredictable. And you're going to design the pharmacoepidemiological study in such a manner that you're going to find out whether it is specific or sensitive. Whether it is a specific or sensitive. So using a questionnaire, you can find out whether it is specifically connected to vaccine or not connected to vaccine, that is sensitive one. Because again, it depends on this depends on the patient response due to vaccine, depending on the manufacturer, lot number, vaccine components, and vaccine sequence and age of the vaccine. Important. Okay.
That I need workload for that academic file.
1 second, my dear students. I'll be. So it depends on the vaccine manufacturer. So that is why even vaccine components, lot number, vaccine sequence, age of the vaccine also. You can see here age of the vaccine. See how much important each component is in the vaccine, including the age, sequence, and manufacturer, lot number. So you can just imagine the complexity associated with the vaccine safety assessment. But pharmacoepidemiology study uses the questionnaire, exact questionnaires, in order to get the information about the one which is specific, related to, closely related to vaccine, and the one which is unknown, which we call it as sensitive. This word which is sensitive is used because of the hyper response or hyper response of the patient, right? So that is how the pharmacoepidemiological concept is going to be used in order to find out the known and unknown adverse events that are associated with the vaccine safety. Okay, is it clear? Can we move on to the next methodology? Anybody has any clarity? I mean, any doubt? Can we move on? Because they look like a similar one, but very slight difference will be there. So make sure that you know it clearly. Can we move on to the next one?
Yes, sir.
Yeah. So the second approach from the pharmacoepidemiology concept is that standard definitions and the evaluative protocols using standard definitions and evaluative protocols. See, before we go into this, let us understand what they mean for us. Then only we'll be able to understand it. Um, Irene Sarah, what is a definition?
Sir,
What is definition?
sir, definition means something like describing. I don't know, sir, how to properly answer it.
How many definitions you have written so far in the examination?
No,
Many, right?
like, yeah,
Yeah. So you have
I
a
don't know
complex
how.
expressing, right? So it has become very complex to express. Okay, no problem. Good try. Kamal, Kessia Kurian.
Describing what a word means, or
Sorry, could you please repeat?
describing what the term means,
Describing what the term means.
the meaning of the term.
Meaning, okay. Yeah. So describing what it means. So can it differs? Can it differ from one person to one person? I describe in one type, and you describe in another type, and third person describes in another way. Can it happen like that?
No, sir.
All three must describe similarly.
Yes.
Then only you call it as a standard. I mean a definition.
Yes.
Correct.
Yes, sir.
Your answer is perfect. So we should use the definitions which should describe the meaning of a word or meaning of the any fact similarly. Then what happens, whatever the analysis and whatever the study which we do will be very clear, and it can give sound results and standard results. Instead of sound, I call it as a standard results. That is why using case definitions will give the standard results when we do the adverse event analysis, which will be accurate in nature. So to do this, you need to use the same uniform vocabulary. Then what happens is that naturally you get the you get the information which will help the pre-licenser more to give the license for you. So this also helps, even though the data is less, but having used standard definitions, the data will be accurate, where you can base on that to go for the preventive measures whenever the vaccine is administered. Now, whenever we want to use the standard definitions or what is known as case definitions, we are going to use it from different angles in pharmacoepidemiology. The different angle in the sense that we are going to use closed-ended questions and open-ended questions. Now, before we understand this, what is this? Let us understand what we mean by closed-ended questions. Kezia Rachel, what do you mean by closed-ended question? Do you have any awareness on that? Kezia Rachel?
Sorry, sir, I don't know.
Kindle you have a okay. Lakshmi? Lakshmi Jayachandra? Manoj?
Don't know, sir.
Megha?
A question with particular options only. From that only we can respond. Like we can give response based on that options only.
That is called as open one, closed one.
Closed one. Open means we can give different opinions. Like
okay, can you put one simple question for the closed one?
Sir,
you give an option in your question. Let us see.
Yes, sir. I don't know.
No, put it. Your answer is correct. You know the fact. Put it in the question. You know the fact. That is good. Beauty of it is that you know the fact. Put it. How do you put the closed-ended question?
So it's like yes or no questions. Like
tell me. Okay, you put the question on yourself only.
Okay. Are you like interested in getting this a particular thing or not? So they can only give an answer like yes or no.
Okay. Open-ended one.
Open-ended one. Why? What is the reason we'll ask? Why you're getting this, and for what? Like that.
Okay. Yeah, I'll put it in a different manner. The closed-ended questions, like for example, you say that whether mega is good. So option is only yes or no. So either you have to say mega is good or bad, or I don't know. Only the closed answer you're going to get it. So that is called as closed-ended question. The choice is given to you to answer yes, no, or maybe I don't know. That's it. Only one option is given to you. Open-ended. I heard a mega is good. Can you justify? Now the people will come out with so many answers. That is called as open-ended questions, where your question will lead to many answers. Right? I hope everyone is clear. So similarly, here also what happens is that the pharmacoepidemiological concept will tell you you can use this question at any given time during the study at any given time, and you can you either put closed-ended one and open-ended one depending on the answer or depending on the data you wanted. So this helps to analyze the specific adverse event data if it is a closed one, which is known. For example, I'll give one example. Let's say, for example, vaccine, say mumps vaccine is likely to cause headache. So your closed-ended question, after taking mumps vaccine, did you got headache? Yes or no? If you say yes, then it is confirmed. The known fact is confirmed. That is known as specific data. Sensitive data, when we don't know. Tell me what are the different adverse effects which you have experienced after the administration of the mumps vaccine. That is called as open-ended questions, where you get more data. Somebody says that I did not experience, or somebody says that yes, I have experienced headache. Somebody says I experienced somebody body pain. So you tend to get many data here in the sensitive one. So that is how the pharmacoepidemiology helps helps in the evaluation of the vaccine safety. I hope this is clear to everyone. Okay, we will stop at this particular point. We will take up the other things in the next class. Manoj, please send me the absentees name. Thank you.
Okay, sir. I'll send you.